New Diabetes Supplies by the Diabetes Education Program at the Hospital for Sick Children. Your child's diabetes team has provided you with prescriptions for new supplies to use at home. This video explains how to use those supplies to manage and monitor your child's diabetes. The prescriptions for your supplies should include blood glucose test strips, lancets, these are the needles used for finger pokes, blood ketone test strips or urine keto sticks, insulin, pen needle tips, a Glucagon hypoglycemia kit, Baqsimi Glucagon nasal spray, and a sharps container. To check your child's blood glucose levels, you will need a blood glucose meter, test strips, lancing device, and lancets. Use a brand new blood glucose test strip for each test. You should get into the habit of changing the lancet at the same time each day, for example, before your first test of the day, as it can be hard to remember if the lancet has been changed or not. Getting into a habit will help you remember to change the lancet once per day. Dispose of used lancets in your sharps container. Your blood glucose meter has 1 to 2 small batteries inside. These can be purchased at a dollar store. You should have a spare set of batteries inside your blood glucose meter carrying case in case your blood glucose meter loses power. Remember to record your blood glucose readings either in a logbook or on a smartphone app. Some blood glucose meters connect wirelessly with a smartphone app. Contour Next 1 meters connect to the Contour Diabetes app, AccuCheck Guide meters connect to the My Sugar app, and the OneTouch Vario Reflect meters connect to the OneTouch Reveal app. When checking for ketones, use a new ketone strip for each test. There are instructions inside the box that help explain the results. When checking for urine ketones, use a new strip for each test. Take the strip out of the container and then close the lid. Exposing the small peach-colored cushion on the end of the test strip to too much light can change the results. Dip the peach-colored cushion on the end of the test strip into the container of urine. Count 15 seconds and then match the color of the cushion on your test strip to the colors on the container. This will tell you the urine ketone level. Once the container is opened, the test strips inside are only good for 6 months. After 6 months, you will need to dispose of the container. Throw any remaining strips in the garbage and recycle the container. Get a new container of test strips from the pharmacy, but wait to open it until you actually need to test for ketones. Keep this container in a cool, dry place away from direct sunlight. Ketones should be checked during illness and when your child is experiencing signs or symptoms of hyperglycemia with high blood glucose readings. Ketones will be discussed in detail at your first education class. Supplies storage. When you receive your insulin from the pharmacy, it will be in boxes. These boxes need to be put in the fridge. Your fridge should be set between 2 and 8 degrees Celsius to keep the insulin working properly. Insulin should be kept in the fridge until you are ready to use it. Always check the expiry date on your insulin box to ensure you are not using insulin that has expired. Keep insulin out of reach of young children. Insulin should never be in conditions of extreme cold or extreme heat. Never put insulin in the freezer and never leave insulin in a hot car. When traveling, cooler bags, such as an insulin cooling wallet, can be used to maintain the proper temperature of your insulin. Your insulin will either come as cartridges to be used in a reusable pen or as a disposable pre-filled insulin pen. Here are some of the examples of insulin cartridges and pre-filled insulin pens. When you are ready to use your insulin, take it out of the fridge and keep it at room temperature. Make sure the room is no warmer than 30 degrees Celsius. Only take out 1 cartridge or pen at a time. Always keep your insulin pen stored with the caps on. Leaving the caps off may expose the insulin to too much light, which can affect how well the insulin works. After a certain amount of time at room temperature, the insulin must be discarded, even if there is still insulin left. If the insulin has been at room temperature for too long, it will not work as well. When you need a new cartridge or pen, it can be taken out of the fridge. Basaglar, Humalog, Humulin N, Novorapid, Novolin NPH, and Lantus insulin are good at room temperature for 28 days. Levemir and Toujeo insulin are good at room temperature for 42 days. Tresiba insulin is good at room temperature for 56 days. It helps to put an alarm or reminder on your phone to help you remember when to take a new insulin cartridge or pen out of the fridge. Always use a new needle tip for each injection, and remove the needle tip before you put the pen cap back on. Dispose of needle tips in your sharps container. These are 2 different brands of needle tips we use at Sick Kids. One brand is not better than the other. If your child finds their pen needle tips to be uncomfortable, they can try the other brand. Glucagon is an emergency medication used when your child's glucose level is very low and they are unable to safely eat or drink. It can also be used during illness to keep blood glucose within target if your child is not eating. You will learn how to use this medication in your second education class. Store the kit at room temperature between 15 and 30 degrees Celsius. Keep it somewhere safe and out of reach of children. After reconstituting this medication, any unused portion must immediately be disposed of. Do not use the medication past its expiry date. Like the Glucagon hypoglycemia kit, the Baqsimi Glucagon nasal spray is an emergency medication that can be used when your child's glucose level is very low and they are unable to safely eat or drink. Do not remove the plastic wrap until you are ready to use this medication. You will learn how to use this medication in your second education class. Keep the medication somewhere safe and out of reach of children. Store it at room temperature in an area that is no warmer than 30 degrees Celsius. Do not use the medication past its expiry date. Dispose of all pen needle tips and lancets in your sharps container. It can be obtained for free from most pharmacies with the sharps program. When the container is full, return it to your pharmacy and get a new one. Be sure to ask the pharmacy about travel-size sharps containers. Additional supplies. You also received 1 bag of insulin syringes. Insulin syringes can be purchased at your local pharmacy and are not covered by OHIP Plus. Use these when your child is ill to give small doses of glucagon. This will help to keep their glucose level within target if they are unable to eat or drink. You will learn more about this in your education class on illness management. Things to remember. Keep medications, pen needle tips, and lancets out of reach of young children. Always check the expiry date on all of your diabetes supplies before you use them. Do not use your supplies if they have expired. Get new supplies from your local pharmacy. Before each clinic visit, check with your pharmacy to see if any of your child's prescriptions need to be renewed. You can then review this information with your child's team to make sure you never run out. Thank you. We are here to help. If you have questions or need further tips, please contact your diabetes healthcare team.